session is about supportive medicine, the myths about it and the realities that are there. And we have distinguished guests out over here who will guide us in their respective fields. There are not much questions over there. They are just going to put what they do in their practices. Right? So I will request Prasad sir, a senior most homeopath, as to how sir deals with cancer cases and how do you support or how do you augment the mental health of the individuals.
Okay. A very warm welcome to all of you in this afternoon post-lunch session, and I'm quite sure you are awake. Okay. First of all, thanks to Rising India Research Foundation for inviting all of us for this specific discussion. Dr. Nilesh sir, he has asked very perfect question that how do you deal with the cancers with homeopathy? In the morning session, we have learned a lot of things regarding the cancer. When we think cancer and their treatment and palliative measure, etc., all those quality of life, my question is that we never think what is cancer, why this has happened, what may be the role, what may be the result because of which the person grasped the cancer. We only, the people, layman, the patients who comes to us, they only knows they have cancer. If you ask what do you mean, they means increased number of cells are there which are not useful. No one asks question why this has happened. What is the reason behind this? And when we take into consideration the patient, we never take into consideration the cancer, we take into consideration what is wrong with the patient. We have to understand first what is that human being and what is wrong with the human being. When we consider homeopathy, we take into consideration both the aspects, the material aspect, the physical homeopathy, a physical human being, as well as the dynamic human being at the level of mind. And both things should be in harmony. The mind, the vital force, the soul and the body, when it remains in harmony, the person remains healthy. When something happens in life, there are many things which happens. Right from the birth till our last breath, there are n number of forces acts on us, which are responsible to disturb you every time you react. If you adapt situation, you remain healthy. If you don't adapt it, you go into disharmony. And this disharmony happens at dynamic level. First affects the mental state of that human being. If it persists for a longer time of duration, it reflects at the physical level. Depending upon the susceptibility of that individual, it reflects in the form of disease. It might be anything. It might be some cardiovascular disorder, it might be anything. One of them is cancer. The personality, if the person who is that person who is susceptible to that, the harmony disturbs, and it disturbs the normal flow which happens in the human life. In our day-to-day life, right from birth till death, there are two types of divisions of cells happens. One is mitosis and one is meiosis. That means from one cell another two cells develops, or one cell is developed. Both and the new cells, they are working cells, they are working and healthy cells, which can regenerate, which functions, etc. Because of this disharmony which happens in his life, which disturbs this parameter, and all of a sudden the cell which was dividing 1:2 or 1:1, that equation disturbs. And once it's disturbed, it affects, it produces number of cells. From them, number of cells again develops, and all are not working, not useful for our body. It's the flesh for the healthy cells, and that's those cells we call by the name of cancer cell. So cancer is prior to this Cells is the result of it. Number of when you kill the cells, when you treat them surgically, recurrence is the rule because it happens because you have not treated the prior disease. Homeopathy treats that. Homeopathy works at that level because we take into consideration the whole human being. I used to give 2 hours to cancer patient. I keep only one appointment per day. And used to give 2 hours because I have to understand that human being, what is wrong with that human being at the physical level, at the mental level, what is wrong at the hereditary level, everything which we have to take into consideration. And once we understand that, then our treatment depends. It never depends upon the name of the cancer. It depends upon that individual.
Right.
And if you treat that specifically, then automatically, if you bring back that harmony,
Right.
you bring back the health.
Nice, nice. Sir has tried to explain that it is the mind that also we study prior to what the cancer takes place, and accordingly we treat them.
Yes.
We'll come again back to you, sir. Inamdar sir, again a senior most Ayurveda Charya. Sir, from your aspect, how do you deal with cancer cases?
Yes, as Dr. Prasad has rightly said, we must think whenever there is a effect, there is some cause behind it. So when we understand the cause, we can treat its effect. So when we understand the fundamentals or rudiments, then we are able to treat the causes, whether it is a mental or physical. It is a question like egg and hen story, which comes first, whether it comes in mind first or whether it comes in body first. Sometimes symptoms will be in the body, then the cancer will be in the mind. Or sometimes, may I get cancer? My father, my mother was having a cancer, that is in mind, and after 45 years or some 30 years, 20 years, then cancer appears in the body. So what is first and what is last? Let's forget about everything. So focus what should be the ideals of life. Ayurveda always advocates that life should, you have a determined life. There is a chronobiology in body. So according to the time, you should act. In daytime, you should be aware, awake. In the night time, you should sleep. That cycle we have changed. Diet we have changed. So the lifestyle, diet style, all diseases now coming upon this side, but nobody is ready to change their lifestyle and diet style according to the reason, according to the season. So in Ayurveda, generally when the patient comes to us, we focus on his dinacharya, ratricharya, rutucharya and seasonal panchakarma, that is shodha. Touch is the best therapy for the patient. When we do the panchakarma for these patients, shirodhara, actually patient gets very good deep sleep. His major fear, anxiety, depression, stress levels come down, and that's why the disease process gets arrested. Let's live with the cancer. That should be the principle, whether we are not going to cure. According to Ayurveda, for all diseases, there are sukha sadhya, which means easily cured, kashta sadhya, that means difficult to cure. Some, they are good till you treat it, that is a yapya, and fourth, that is a asadhya. And according to the four things, our our physician's mentality should be there. Maitri Karunya Marteshu Shakya Priti Upekshanam. That should be the four types of physical mind, means physician's mind should work. You should be friendly with your patient. You should have empathy or sympathy towards your patient. Third, you should have affection or live. And whenever it is incurable, you should have upeksha in your mind. So with these four types, a doctor can bring his mental illness also well. And according to this, dinacharya, rutucharya, ratricharya, panchakarma, with this help, we can avoid recurrence as well as we can treat the disease well.
Right, sir. So, any highlight around Vata, Pitta and Kapha that you would like?
Yes, this
In brief.
in harmony as Vayu, Pitta and Kapha Sthiti, Trayo Dosha Samasata. Vayu, Pitta and Kapha, Vata, Pitta, these are the balance of three doshas. In the morning, generally we have Kapha symptoms. In the afternoon, we have Pitta symptoms. In the evening, we have Vata doshas more. Even there is psychoneuroendocrine studies that has been happened. In the morning, histamine levels are more. In the afternoon, adrenaline, noradrenaline levels are more. In the evening, acetylcholine levels are more. So these are the happy hormones. If we can increase with the balance of these three dosha, vata, pitta and kapha, with this treatment, definitely we can arrest, we can give a good relief to our cancer patients.
Thank you, sir. Shraddha ma'am, what do you think is your role as oncophysiotherapist?
Yes, thank you.
Very rarely heard this term.
Yeah. So as you said, it's definitely one of the rarely heard terms. To briefly tell you, we can divide the onco-rehabilitation or the onco-physiotherapy in three parts. That is pre-operative, post-operative, and then palliative. So in pre-operative, we usually start with the rehabilitation to strengthen the muscles. Then post-operative, to get back the range of motion, to get back the muscle strength, to help the patient to get back to their normal life. And I would say it's a bit different in curative treatment as compared to the palliative treatment. In palliative treatment, usually the rehabilitation goes from the patient's point of view. I think Dr. Kulkarni would agree to this, that recently we had a patient at Cipla. He was an athlete, and unfortunately due to the bone disease, his leg was amputed. So when he was admitted, his first chief complaint, usually patients who admitted are, they have a complaint of pain, then sleep disturbances and everything. His first complaint was, I want to walk on my own. So of course, with the supportive treatment of pain management and medicines and everything, we started working on his muscle strength of the amputated leg, and it's a huge success for the physiotherapy department that after a week or so, we could manage to walk him with the help of walker on his own. And I think this is the major difference. In curative, I can set goals for the patients that I need your hand to go up in these many days. I want your edema or I want your swelling to go down in these many days, and we'll work for that. But in palliative setup, it is always a patient-oriented goal.
Great. Very beautifully explained. So the term goes as, cure cannot be defined. Are you getting what I am saying? Cure does not have a definition by itself. Cure differs from person to person. मुझे कैंसर हुआ है, मेरी चाहत है कि मेरा बच्चे की शादी देखूं, तब तक जीऊं. That is cure for that person. उतना जी लिया, that is achieved. This is what we also learn from homeopathic perspective, what our master in his first aphorism says, the highest mission of physician is to restore sick to health, to cure as it is termed. See, very perfectly he has used the word. So there also he is highlighting it, no, cure is absolutely an individual need. You cannot define that from QOL, quality of life क्वेश्चनरी से हम ये बातें नहीं कर सकते. अपना क्वालिटी ऑफ लाइफ का क्वेश्चनरी हर पेशेंट के लिए अलग बन सकता है, इज व्हाट आई परसीव फ्रॉम व्हाट ऑल यू हैव सेड. यस, बैक टू प्रियदर्शनी मैडम, आप बताइए, हाउ इज योर पैलिएटिव केयर ट्रीटमेंट प्लेइंग रोल इन कैंसर केसेस?
Hello. So earlier session, I was thinking I should have been a part of that discussion group to complete the cancer treatments which happen in an allopathic way of treating the patient. So medical oncology, surgical oncology, radiation oncology, and palliative care is the fourth aspect of cancer care, which is gaining importance now compared to last 20 years that I am practicing. And it has become a medical subspecialty now since last 10 years. I'm fortunate to be a part of this group because I have to learn so much from other pathies and also see how allopathy and other pathies can work together, because what we are all trying to do at the end is to help our patients to be the patient with better quality of life. We want our patients to have less suffering. We want them to get less pain and therefore have an accomplished life. I think the role of palliative care during cancer management is not to just treat the symptom like pain or vomiting or whatever, but in addition to that, considering them, as Sir was explaining, looking at them as a person with a problem, understanding in addition to their physical problems, psychological, social and spiritual aspects where they need care. And with a multidisciplinary team, we have a group of people where doctors, nurses, medical social workers, counselors, physiotherapists and also volunteers have a role to play to make these patients still have a meaningful life. And that's the role of palliative care. Thank you.
Great. Is the message clear? The message that I perceived over here was, and definitely I would like to have it from your end also. What is the message we have perceived? Any one of you, please. See, it is always मैं जो बोलूँ वो सच ऐसा नहीं है. I mean, then and then I will realize कि ये सबने खाना तो मजे से खाया है, लेकिन yes. Neeraj ji.
No, I was just observing in terms of how this, you would also kind of mentioned the word supportive. I think there's a need for integrative processes, I think, in all of these. This physiotherapy for oncology is virtually non-existent. And I think the definition of palliative is always end of life in India. I think there is a need to redefine this entire process of palliation.
Nice.
And I think we need to understand it.
Nice, nice. It was again a new vision from your end, sir. That definitely the word palliative needs to be redefined and seen in new context. कि बाबा नहीं यहाँ से तो लाइफ अभी शुरू होगा. Great. Yes. Okay, okay. Actually. Nice, nice. Great. So there was addition in our knowledge as well. Yes.
Just to add to what Madam said, in Marathi we say that पांघरून घालायचं. तर आजारासह जगताना त्या पेशंटला पांघरून घालून त्याचे त्रास कमी करण्यासाठी मेडिकल म्हणजे फिजिकल, सोशल, सायकोलॉजिकल आणि स्पिरिच्युअल सगळ्या प्रकारांनी त्याचा सर्वांगाने विचार करून जी ट्रीटमेंट द्यायची ती पॅलिएटिव्ह केअर. थँक्यू.
Right. And I appreciate Priyadarshini madam कि you are not regretting to be there in this group. Which earlier you had thought that it would have been better if you would have been in the earlier group.
No, I thought I had.
But here also, I am grateful to hear from your end that you have used one statement over here, that all the three needs to be integrated. It's not three, all. And it is for the betterment of the individual, the sufferer, the deceased. Nice. So in context with all this, Prasad sir, can our medicine go along with conventional line of treatment as she has said?
Yes, my question is why not? It can be, or it can be, because if patient is already on some treatment, he never comes directly to us and starts homeopathic treatment.
Why the question has come up is because as soon as the patient is, to us actually the patient is brought by someone.
Yes.
They never come
Yes,
directly to
yes.
us. उसने बोला कि उधर ले लो, अच्छा है ट्रीटमेंट, उसने बोला उधर ले लो, ऐसा ही रहता है अपने पास. And there when the patient enters, उसका पहला क्वेश्चन है, ये चल रहा है मेरा, ये लूँ क्या?
Yes. I never says no, because there are two ways. One pathy works on the physical aspects of the human being. It kills the cells, etc. What already I have told, that it tries to kill the cells. when I will prescribe a medicine which is not at all disturb the action of allopathic medicine or a material medicine, it will work in its own plane, that is dynamic plane, because the homeopathic medicines are absolutely dynamic medicine. And it works at the dynamic level where the fault is. Two works at two different levels. If patient is taking allopathic medicine, I never ask him directly to stop it, not necessary, let him continue. My suggestion to every patient is that you should not leave the homeopathy. It treats the center, it treats the core. If you treat the core, future will be bright. So I never says no directly.
Great.
And that helps a lot. Many patients who are in terminal phases, but they recovered, and they recovered so nicely that they never expected that they will recover because of this.
True. So again, there was a message. There is this fear amongst patients, amongst relatives, amongst practitioners that no two pathies will go together. And I being homeopath, we are into practice of cancer cases, more than 1300 cases as of now I have. I was really cherishing the morning moment when Dr. Kopikar sir and Dr. Anand Bhushan Ranade sir were here. Because they are not knowing, but I know that I have patients between amongst us. Idhar udhar jate, sab jagah jate. And I appreciate the answers they give, because when patients talk to us, good, to the point, ये करना है, नहीं करना है, please stop, ऐसा बोलते हैं लोग. And that is the great part of it. And what sir has rightly pointed out just now, कि क्या करता है homeopathic दवाई? What it does, is it in material form? It is not in material form. उसमें कोई जैसा डोलो 650 बहुत प्रचलित है आजकल वो. It is in milligrams. Homeopathic medicine has no such milli नहीं, microgram भी नहीं है. And then how does this work? It is in the energy form which stimulates my energy within. जगाती है मेरे को कि बाबा उठ, कुछ तो अंदर गड़बड़ है, काम कर. This is fact. And it helps over there to boost my energy within. Now what happens with this? When my energy is boosted, in layman's what we talk is pratikar shakti improve, immunity is improved. What happens? I will bear the other medicines safely. So the adversities which are there with the other medicines will be comparatively less. नहीं होगा ऐसा नहीं बोलता मैं, but it will be comparatively less, definitely. As well as the efficacy of those drugs will be enhanced. यानी पेशेंट की प्रतिकार शक्ति अगर इम्यूनिटी कम है तो वो इफेक्ट भी उनको डोज भी कम देना पड़ता है. बट ये सब नहीं होगा if simultaneously patient is on homeopathic medicine, as what sir rightly said. Please do not stop that. Sir, Sunil sir, आप सेम क्वेश्चन कन्वेंशनल आपकी ट्रीटमेंट के साथ चल सकता है.
Yes. First thing I want to say that people believe in Ayurveda. People believe in allopathy, but they have faith in Ayurveda. Even they are continuing with allopathic medicine, most of the patients, or 50-60% of the patients, they are continuing their Ayurvedic medicines. There are a lot of data which shows there is no any drug interaction, there are no any drug interactions or any other adverse effects are there. If two things are working for betterment, let's continue the both treatment. That is our advice to our patient. Everywhere now, previously surgery, radiation, chemotherapy was there, but now a new term is coined in cancer, and that is called as immunotherapy. Now system of immunotherapy organization is also launched in Bombay Cancer Hospital last year. But in immunotherapy, all these drugs like Ayurvedic drugs or homeopathic drugs, they are very good immunological agents. This increases cell-mediated immunity, and due to that, the patient fights well with the cancer disease. So the production of new cancer cells as well as resistance of new cancer cells, that is motivated with the help of Ayurvedic drugs. So the mode of Ayurvedic drugs is little bit different than the killing effect of the chemotherapy and other drugs. We have done lot of research trials with the help of ARTC, Kharghar, Mumbai, given some Ayurvedic drugs, working on them on cell line. Since last 10 years, we are doing some experiments. We are giving Suvarna Bhasma, Hirak Bhasma, or copper, zinc, and there are so many other products, or Ayurvedic mixed products and mixed Bhasmas. We are trying that drugs on cell line study. And actually, in this cell line study, we do combination of therapy with methotrexate, with some other agents also, with herceptin and with these drugs. What are the combinations we can use? So we find that the Ayurvedic drug helps the means the drug reduces its toxicity, reduces its resistance, so the patient can continue chemotherapy, because due to side effects we have to stop chemotherapy in between. But with the help of Ayurvedic treatment, their blood counts really goes well. WBC count, RBC count, platelet count maintains well with the help of some Ayurvedic drugs, and that's why patient can go continuously with chemotherapy. So it works as an adjuvant also. It works as a supportive also. It works as a tissue promotive and preventive also. So there are different kinds of roles, and it works, and it helps to prevent the remission and relapses, which are very common in cancer. So all these kinds of virtues, I don't think nobody would like to have in their practices or in their clinics. But role has to be established. We are working on it, and soon, within 5 to 10 years, definitely Ayurveda will be in the mainstream of system with these medicines, and with his definite role of treatment with the help of Panchakarma and all this Dinacharya and Rutucharya. So it is very effective, and both treats, when they go well, definitely our aim is recipient's benefit. We should benefit our patient, whether psychologically or medically. Both things can be achieved well with the help of Ayurveda. So we should work, means interdisciplinary work should given more importance for such kind of works when we go for the treatment. Thank you.
Thank you. Thank you. Again, the message was very clear from Ayurveda point of view as well, that it definitely boosts the individual's immunity. Shraddha madam, any conventional line of treatment होना ही चाहिए ना, आपके साथ क्या चलेगा नहीं हुआ तो?
I think physiotherapy goes hand in hand with all the conventional therapies, I would say. May it be pain management, may it be medicine, may it be supportive medicine. Physiotherapist needs assistance of any of the conventional therapies, I
The
would
question
say.
was just to bring the awareness. And what about that for palliative care?
So, as I said, palliative care, medical management belongs to allopathic medicines. So, for so many years, till recently, we always used to say that we don't know if allopathy and Ayurveda, allopathy and homeopathy, if they take these medicines together, what will affect adversely on what. Recently, as Sir mentioned, now trials are being done and research is being promoted, even with Tata Center and all. So I think we are heading towards getting some definitive research results. And very soon, once that is clear, then I think people will opt for concurrent therapies together.
Right. So we have a good platform today where palliative can work with homeopathy, where palliative can also start working with Ayurveda.
Actually, patients are taking it. They are not maybe directly telling the practitioners. But when you're sitting as a consultant and you don't know anything about other pathy, their side effects, you cannot really convince either ways.
I am directing it to Girish sir कि कुछ तो एक नया scope और है हमारे पास. All right, thank you again. Any limitations you come across?
Palliative care?
Yes.
Quite a lot, because as many of you would agree, even in allopathy, people will think palliative care is just end of life care, which is not true. palliative care starts at the diagnosis of life-limiting illness. It goes simultaneously with curative treatments. When you are giving chemotherapy, a role of palliative care may be counselor's role to accept this disease is just there. When there are symptoms like pain, a doctor's role will come. And when chemotherapy is not working, then palliative care consultant can take over and we can help patient as for end of life care. And even when patient passes away, we can help families in terms of grief and bereavement management. So it's a huge role one can give for patients and families, but many a times people only know little bit about palliative care. And I think this lack of awareness about palliative medicine as a specialty is a major problem at the moment.
Sir, again, take care of. Yes, Shraddha madam, from your aspect.
I would say onco rehabilitation concept itself is considered as a myth, because a lot of time when we approach a patient, the first response which comes is की तुम्हाला नक्की कळतंय ना, म्हणजे मी एवढ्या ऑलरेडी त्रासातून जातोय and you are asking me to do some movements, you are asking me to do the exercises. How is it going to help me? It will just worsen my condition. So to just sum it up, I would say कि right from the moment a person is diagnosed with cancer till the end of life care, rehabilitation plays a very important role. And the best part about is that you do not need any kind of referral to go to a physiotherapist. You do not need any recommendation. You don't need your doctor to give you the permission to go and see the rehabilitator. So I think believing that exercise is going to, or the few muscle oriented activities, may it be end of life care, it is going to help you to sustain the phase.
Right. But then definitely it would have been better if doctors knowingly refer.
Yeah, but I would say I came back from Mumbai 4 years back. So when I came here, in Pune also, it was a very new concept. But now I can happily tell you that doctors are voluntarily referring patients,
Excellent.
may it be during the chemotherapy, may it be post-radiation, or may it be the end of life care. So the awareness is
So it's a
definitely
positive
increasing.
step.
Yeah, absolutely.
Prasad sir, any
Yes.
limitations that you come across?
No. First of all, I never say there is a limitation. I handle the case in whatever condition patient comes. There is no, there is little bit difference, madam. The homeopathic palliation and allopathic palliation, that is the thing I want to share. In homeopathy, there is no separate medicine as a palliative. Whatever is the patient's medicine, the same medicine, if patient is in a curable state, works as a curable. If patient is beyond curable state, it works as a palliative. So there is no difference that you have to change the medicine. That is first important thing. I will share one simple example. There was a patient in April 2016. Just there was a call from Sambalpur in Odisha. Doctor, I got your name from one of my colleague, and my wife, she is suffering from the blood cancer, lymphoma, and she is in last stage. She was diagnosed in AIMS hospital. Then she was shifted to Apollo Hospital, Chennai, where we have given the chemotherapies. Again, they gave two chemotherapies, patient worsened, and then that patient was shifted to Rajiv Gandhi Cancer Hospital, Delhi. And they were not admitting, with political force they have admitted, and they have given 2 more chemos, and patient was on verge of death, and they said, you take them, patient home. She is in semi-comatose condition, just whatever we put in mouth, she drinks, that's all, and she is not in a condition to talk. So everyone is meeting her, we are expecting death. Does homeopathy do anything? And same day, he called me, I asked him just to fulfill my case paper. I have asked that I will not send medicine, there is no time. I will tell you these are the medicines which you start immediately. It has been started on April 2016, and gradually she started improving. when she first come out of her house and sit over there, she took her photograph and sent it back.
Great.
And then on 1st of January 2017, she joined the Sambalpur University, and till today she is working in Sambalpur University.
Great.
And
Excellent.
absolutely not taken a single allopathic medicine, nothing thereafter, and she is on homeopathy, and she is absolutely. So there is, you cannot say this is the limitation. You have to start, yes, that's all. I will try my level best to treat with
I
homeopathy.
appreciate
that's
the
all.
message goes as do not see limitations overcoming your own. It
So
is
that's-
scope everywhere.
So homeopathy works in such a manner. So I never say any patient
Correct,
is
correct.
no. You start it first. If it will going to work, it will not cause any harm to you.
So any
That is more
myths
important.
you are coming across
There are many
related
myths.
to homeopathy?
There
Common
are many
myths.
myths.
I mean,
There is
or
one
two.
common myth is that homeopathy is very slow in acting. That is the first common myth which is there. But I have seen the cases that I put the drop in the mouth and the stones are coming out. It worked instantaneously. There are many instances are there. It is not like that. If the patient is having 10 years problem, he will not going to settle next day. It will take little bit time to recover because his vitality is disturbed.
Correct.
So that is first myth is there. Second myth, which is common in people's mind, that homeopathy is a placebo therapy. That is another thing. When things are dynamic, which are in dynamic means the things which are present but which are not visible to naked eyes are called as dynamic. If they are dynamic, the people, common man, never accepts it. They want, yes, I want to see something, I want to show something. They ask me how your medicines acts. It acts directly. If you put it in mouth, that's all. It started working. There is no need that it should go to GI tract, then it gets absorbed, then it goes to blood, and then it works to that place, and then it works. It works instantaneously because the medicines are dynamic. And the things the person expects that in the material form, which we cannot show because dynamic things cannot be shown. And that's why this myth is common with people's mind. First important thing, here you have to accept the things on the basis of cause and effects. If the magnet is there, iron piece is there, we consider that there is a magnetic energy because it gets attracted. We cannot see the magnetic energy in between. We have to understand there is a cause and effect on the basis of which we accept. Same is true with homeopathy. We have to understand and accept what is cause and effect on the basis of which we have to understand the things. We cannot show it materially.
All right. So there are myths in homeopathy. Yes, Sunil sir.
Yes, there are always, whenever there is no scope in allopathy, people always, there are always limitations in allopathy, people always find scope in Ayurveda and homeopathy. Means patient believe that there is some scope. But I think it should be started from at the case of diagnosis also. In early case, prevention is possible with Ayurveda and homeopathy also. So at these stages, we should start. So there is a myth that Ayurveda, you should start in a late phase, or at a palliative care, you should have interdisciplinary studies. But at initial stage, at the stage of diagnosis, before taking the decision of surgery, during those periods also, if we start with Ayurvedic treatment, definitely we see the regression on the PET scan also with the patients in the recent studies also. So whenever we work together, we should understand, we should give same opportunity to each pathy to understand its efficacy and what is good for that patient. I don't say every patient will respond to every pathy in the same manner. There may be some differences, and according to these things, we should understand, we should finalize the scope and limitations of each pathy, and we should work for the recipient's benefit.
आखिरी क्वेश्चन दिमाग में आया है, एक टीवी पे ऐड देखते थे हम, कितना देती है, यानी एक कार बेचने जाओ तो माइलेज कितना देती है, सर खर्चा कितना आता है? It will be varying from physician to physician. मैं एक रफ अप्रोक्सीमेट पूछ रहा हूँ, क्या कि ये भी एक इम्पोर्टेंट एस्पेक्ट है इस ट्रीटमेंट का?
Anything is cheaper than the life. So I think the treatment cost doesn't matter if it is very effective. And if it is not effective, a single penny is more. One of my patient, she's Djokovic from Serbia. Came from Serbia. She was taking 15 years Medrol and she was having steroid myopathy. She came to our clinic, she got some references and she came to our clinic. We have given some medicines for 1 year and now she is totally steroid dependent free and everything. When she come to our clinic, we ask her, don't you find this is very costly coming from your country over here, which are and taking these medicines, taking regularly and paying this 2 lakhs or 3 lakhs rupees for a doctor, Ayurvedic doctor? She said, see, Dr. Inamdar, if anything which is effective for me, means cost doesn't matter. It's not effective, a single penny is more.
Great, it was a good message. Any other message? We are concluding over here.
Yeah.
Any other message? Huh? Yeah. There was one question regarding research in this field. Dr. Jay, yeah, you'll just share in a minute.
Fine. Good afternoon to one and all. Basic question always also arises. Fine. Basic question also always arises that how effective and how do you claim that your medicine is effective? Show me in black and white, in paper, in proof. Especially with supportive line of medicines, we always say that your pharmacokinetics, pharmacodynamics and other questions relating to pharmacology are not very well proven. Then where are they? I would like to really ask both the fraternity that is practicing as well as the common men that how much do they know about the research that has been done? Well, when we talk of evidence-based medicine, it is not just the modern medicine that is called as EBM, the evidence-based medicine. We also have evidences from our panelists as well. That is, when I go, there are various publication houses. One of them is Scopus Elsevier's. When I have searched for the word cancer along with homeopathy, I have 2,271 research papers done with 112 relevant articles to clinical studies. When I search with Ayurveda, I'm just sorry, the figures are actually hidden behind on the screen. There is 2,165 research articles with 179 relevant studies. And with physiotherapy, ma'am, I have found greater number of 5,678 research articles with 679 articles relevant with clinical studies, showing the efficacy. When all this is proven, how do we still claim that we are not evidence-based? Also, this is now worldwide. Let's go from global to local. Local, that is Clinical Trial Registry of India. This tells you that your medicine is being tried on individuals. Most of the cases, when admitted, we should always opt for all of this of trying to prove ourselves in the language that everyone speaks. If I am going to some other country per se, and if I don't know their language, I'll not be able to communicate. I will also need a mediator. So these trials stand as mediators, and I always would like senior researchers to be our mentors and the younger generations to pick up these studies, where I just gone through. At present in India, 887 projects are ongoing with cancer as registered under CTRI, and will be surprised to know that 49 of them are under homeopathy, Ayurveda and physiotherapy stand alone, not as an adjuvant but stand alone clinical trials. So time has now come to, rather than talking of, as what was rightly mentioned, being from adjuvant, palliative, supportive at the end in the terminal life, let us start right from the beginning.
Let us understand how we intermingle with the conventional line, with our line, and we do not cause harm to their treatment as well. Let's prove it together. Only and only then, not me, not any other pathy, not any specific medicine, but the patient will benefit. The end result is not my science is better or your science is better. The end result is the patient, and his life is the most precious. Please preserve it to the maximum. Thank you.
The slides were important with the aspect that, Baba, yes, some work is going on in this so-called supportive till time.
Someone is wanting to say.
Yes.
Myself, Dr. Vandana Bhoti. I'm a Homeopath and I'm a cancer survivor. I was diagnosed in 2021 breast cancer. It was accidental detection. Because being a doctor, I was more enthusiastic because I did my test after my 50 वाढदिवस झाला and I said की I will do it. And my cancer was diagnosed at stage 2 cancer. And I took allopathic medicine, I took homeopathic medicine, and one of my Ayurvedic friends, he gave me diet plan, and I took all three things. And I took all three things, and I want to tell very important thing. Chemotherapy मला कुठलाही त्रास नाही.
Excellent.
Great.
I am here to
Great.
Great. Excellent. It was a good example. What we are talking right now, uska ek live example hai. Thank you very much. And the last part of it, sir, any message you would like to give to our august audience from Ayurveda point of view?
See, as we are advancing with the age, with the new knowledge, we should not forget our ancient wisdom. That is always best for the recipient's benefit only. It was not written for any patent or getting more money or getting the benefits. It was written for the personal benefit. So whatever our lifestyle and diet style, you should take care of both these things. First, we are what we eat. So disease is also what we eat, comes from what we eat. So we eat thoughts and we eat food. So thoughts and food. So think twice and eat wise. That should be the principle. Second, you should take dinacharya, rutucharya, ratricharya, and hold this according to the time we should behave. So our behavioral pattern, when gets disturbed, definitely the disease appears. So there are more frequencies wherever the lifestyle get disorders, then this disease can go ahead. So now though so many people stress that cancer arises due to stress, due to lifestyle. So we have to avoid this stressful lifestyle due to with the help of Ayurveda.
Right.
Even the stresses are there, we can go with the Panchakarma therapy seasonally, so it will reduce the body burden of all the toxins or doshas in our body.
Message.
So all these things will
Brief.
help us. So message is use Ayurveda in daily life to reduce the fear of any disease, to reduce the anxiety and stress of any futuristic disease also.
Great. Thank you, sir. Sir.
Message is that in whatever stage, if you have a cancer patient, ask them to use homeopathy. Reason is, I have already told, treat the cause. Prevention, Dr. Sunil, he has explained everything, and yes, that is more important. Prevention is always important. But if case is there, my suggestion is that to start, if you are taking allopathy, if you are taking Ayurveda, if you are taking anything, start homeopathy as early as possible to prevent the further recurrence.
Yes,
That's
sure,
the
ma'am.
message.
As my pathy, that is physiotherapy, goes in hand with everyone, I would just like to say that be aware about all the new facilities which are open, and thus cancer can be dealt in a much better way.
Great. Madam.
I think palliative care is a basic human medicine which includes physical, social, psychological, and spiritual aspects of person's care. So it should be included. Palliative care is a basic human right, and pain relief, relief of the suffering, is for everyone.
All right. So I hope all that the discussion we had was informative from our end to one and all sitting over here. Small poem, and we end with that.
Thank you, our panelists, as well as I would like to give a special thank to Dr. Nilesh Shah. Before we move to the further thing, Dr. Nilesh Shah, we will request you to sit with the panelists because we have a question for you. Okay, so the question is, we see today the increasing emphasis on individualized medicine in modern medicine. This same principle has been the basis of Indian medicine and homeopathy. How do you see this as an opportunity to approach the masses with supportive medicine in oncology in Tier 2 and Tier 3 phase, that is in the rural interior of India?
From all the discussion that we had just now, 50% was directed to Girish sir. And he is going to now take us into the Tier 3 and Tier 4, the rural area and the most needed area also. We'll work it out definitely. This will be of, और काम पे लगा दिया थोड़ा आगे. But he is the person who is ready to take things, challenges. I have seen him. So we'll work.
So which means our audience will soon get to know about it. Yeah. So yeah, a message from you.
A takeaway message for one and all is what Sir had said, Sunil sir, in his Ayurvedic language. The layman language I will say is, follow daily achar, vichar, ahar, vyavahar and vyayam regularly. No expectations, acceptance, and say okay. You will have a healthiest life. Thank you. Enjoy.
I'll just take one more minute. In appreciation to what we have begun today, this is a journey to reach out to one and all. So I have just a few lines that I have written just now. Cancer benign या malignant, कैंसर बिनाइन या मैलिग्नेंट वो एक इंसान तो है ना, ट्रीटमेंट पॉसिबल हो या ना हो, सहारा तो है ना, पता नहीं ये बीमारी क्यों आई तो है ना, अगर जा रहा हूं कल तो मेरे पास आज तो है ना, इस डर, इस गम, इस मलूल वातावरण से निकालने मुझे ये सपोर्टिव साइको ऑन्कोलॉजी है ना, ये सपोर्टिव साइको ऑन्कोलॉजी है ना. थैंक यू.
I think nothing better than this beautiful poem to enhance and tell us about Psycho-oncology Center. Once again, a very, very thank to all the panelists present over here, and a special thank to Dr. Nilesh Shah, who took this panel discussion in a very smooth manner. Thank you, everyone. A huge round of applause for our panelists.